There are many types of Staphylococcus aureus bacteria. Staph bacteria can be normally found in the nose of about 1/3 people of the population and is generally harmless. MRSA is caused by a type of staph bacteria that has become resistant to most antibiotics, such as methicillin. According to the Center of Disease Control and Prevention, this is a result of unnecessary use of antibiotics. There are two main types of MRSA. Most cases occur in people who often visit hospitals and other healthcare settings, such as nursing homes and clinics. This strand is known as healthcare-associated MRSA and is typically caused by invasive procedures such as surgeries and intravenous tubing. The second type of infection can occur outside healthcare facilities and is known as community MRSA. This form usually begins with a painful abscess or lesions. This is very easily spread through skin-to-skin contact. The infection can spread and sometimes become life-threatening. It may spread to your bloodstream. If the MRSA can penetrate into your blood, it can cause invasive infections such as sepsis, also known as blood poisoning, which can put your body into shock, where your blood pressure would drop to dangerously low levels. The bacteria can also affect the lungs, where it can cause airway infections, including pneumonia. The skeletal system can be affected as well and can develop conditions such as osteomyelitis, which is an infection of the bone. Lastly, the heart is also at risk of disorders such as endocarditis, inflammation of the heart valves. As dangerous as it may sound, MRSA can be prevented by some simple measures. Hand washing is crucial in the defense against any infection. An average hand wash should last for at least 15 seconds and should be done under warm to hot water. Keeping wounds and cuts covered will prevent the spread of bacteria. It's important to avoid sharing personal items such as towels, sheets, razors, and clothing. MRSA infections are hard to treat but not impossible. Depending on the severity of the infection, the doctor might just treat the abscess by draining the pus. Both healthcare-associated and community MRSA do respond to some antibiotics. According to a study done by the World Health Organization in 2013, there were 9,000 fewer deaths in that year than there were in 2008. This goes to show that this can be controlled and maybe eventually be eliminated.